Western Reserve University School of Medicine in Cleveland, Ohio. It's the All Access Mid-School Admissions Podcast. Hello again, everybody. I'm your host, Christian Essman, and I'm the Senior Director of Admissions and Financial Aid here at CASE. I'm back, finally. These last 2 months have been nuts. Usually the months of May and June are a little slower for us, but not this year. We and just about every other admissions office in the country has been spending a ton of time working to transition our upcoming interview season into a virtual format. I really can't believe how quickly some of these days have flown by, so I'm really happy to be connecting with you again, and I hope to be able to get more episodes out to you on a more frequent basis going forward. We have some great ideas for some upcoming episodes or special ones about the interview season and what that's going to look like, so stay tuned. We'll see how that unfolds. Also, I know you want to hear from admissions representatives from more schools, and I'm working on it, but I'm finding that many are in the same busy boat that we've been in, and now that we're deep into the summer months, many admissions people are taking some well-deserved time off, so trying to work with some people's schedules, so stay tuned. Today's episode features the Cleveland Clinic Lerner College of Medicine of Case Western, or as we often refer to it as CCLCM. If you listened to episode 12 that I had with Dr. Maida, our Dean of Admissions, we talked about the university program at Case, which is our 4-year MD track. We have 3 tracks at Case Western to get an MD. The university program, our medical scientist training program, which is an 8-year MD PhD program, and our CCLCM program, which is a 5-year MD program. So we have options. Okay, so let me give you a little snapshot of CCLCM. The Cleveland Clinic Lerner College of Medicine was established as a program of Case Western in 2004. CCLCM is a 5-year MD program that trains students to become physician investigators, integrating basic science, research, and clinical medicine. Every aspect of CCLCM is focused on helping students develop the skills of self-directed learning, which is critical for success as both a physician and an investigator. The program is unique in several other ways, too. The 5 years are needed to accommodate the research and master's level research thesis requirement. They have a limit of 32 students per class. It's a problem-based curriculum that uses a portfolio-based assessment, so there are no grades or class ranking, and they offer full tuition scholarships for all students. So we get into all these details with my guest, Dr. Christine Warren. So let me tell you about her. Dr. Christine Warren was appointed the Associate Dean of Admissions and Student Affairs for the Cleveland Clinic Lerner College of Medicine in July of 2019. As the Associate Dean of Admissions, she is uniquely qualified to recruit and advocate for students, as she is a graduate of the inaugural class in 2004. And as the Associate Dean of Student Affairs, she works closely with faculty and students on initiatives supporting diversity and inclusion, career advising, and wellness. She's also a board-certified dermatologist at the Cleveland Clinic and is dedicated to improving the lives of patients with complex dermatologic conditions. She practices at Cleveland Clinic's main campus, which allows her to care for dermatology patients in both the inpatient and outpatient settings, as well as be heavily involved in the education of residents and medical students. Her clinical research focuses on improving photodynamic therapy, a non-surgical procedure for the treatment of non-melanoma skin cancers, as well as teledermatology to enhance access to care. Dr. Warren is a Cleveland native, and like any true Clevelander, she boomeranged back to Cleveland after her residency training at Georgetown and Yale. She is not only a mom of 3 young children, but also to a German short-haired pointer puppy named Derby. Dr. Warren is a lot of fun, and I actually recorded this with her in person because we worked down the hallway from each other in the same building. But we had this conversation before all the COVID disruptions happened, but I ran into an audio issue in the recording part of it, and which took me a long time to fix. So I'm happy to finally get this conversation to you. So here we go. Enjoy. Good morning.
Good morning.
Thanks for doing this with me. I'm grateful to have you here. I've been wanting to have you come in and talk about the Cleveland Clinic Lerner College of Medicine program for a long time. Before we get into that,
sure.
Let's talk about what do you like to do for fun? Are you from Cleveland originally?
I am from Cleveland originally. So I was actually born in Cleveland, but then my family moved to Michigan for a while, but came back. And so I do think of myself as a Clevelander. But in terms of fun, I would love to say that I have some secret hobby or talent. But right now, at this point in my life, my hobbies are pretty much my kids' hobbies. So I have 3 young kids, 3 kids under 8. So what they want to do is what I do.
Yeah. What are some of your, when you have some Dr. Warren time?
Yeah.
What's that look like?
So I enjoy music, listening to music.
Like what?
My husband and I, when we get a chance to get away, we will actually go to a variety of food and music festivals. Okay. So we've traveled down south to some places in Georgia where they'll have, it's more gourmet kind of chefs from around the South that come in, and then they have just small bands or groups that maybe groups you'd never heard of before, but that you get exposed to. I got the chance to go to Austin City Limits and meet up with some of my friends from, I went to Dartmouth College, but cool. We keep in contact and we got together, and we went specifically to see The Cure, which to some of our listeners, they might not have an idea who we're talking about.
But Rock Hall this year.
Yes, they are. So, but it was an amazing time and something on my bucket list.
Oh my God. So are you 80s alternative?
I have to say, yes.
I saw Psychedelic Furs when they were here in the fall, the summer. They're amazing.
Yeah. People are like turning off their turning down their podcast.
They'll get over it. Well, let's just get right into the meat and potatoes of like the curricular highlights. Mm-hmm. Cleveland Clinic Lerner College of Medicine is a unique program. And I get this question all the time about what's the difference between CCLCM and a regular 4-year MD degree and an MD PhD program. Mm-hmm. So how do you describe it to people when you're meeting prospective applicants about what CCLCM is, what it has to offer?
Sure. So our program is a 5-year curriculum. The students know coming in that they want excellent clinical training, as well as a focus on research throughout their time here. So they don't have to think about, if they entered a 4-year curriculum, whether or not at some point they would want to do an extra year of research. They know coming in that's a priority to them. Our program is looking for students that do see themselves in the future seeing patients, being in clinic, as opposed to a MD PhD program. The graduates of those programs do still see patients, but it's usually at a smaller scale. So they might have a basic science lab and be working in the lab about 80% of the time, and 20% of the time they see patients. Our graduates typically do have more clinical time. It might be 50%, it might be 60 or 80% that they're seeing patients. The remainder of the time they are teaching and engaging themselves in research. That's not to say that we don't have graduates that go on to have more of a MD PhD career type model where they're doing research 80% of the time. But I'd say the majority of our graduates are doing the model, the first model I described.
So it's a very niche program, right? I mean, I think there's only one other one kind of like it in the U.S., like the HST at Harvard's MIT partnership. When it comes to the curriculum, walk us through what those kind of first couple year highlights are. I mean, do the students start research on the first day?
The first day after orientation, yes,
yeah.
They do. And they jump right into a basic science research experience the day after orientation. So we're together, the college program students and university program students from the K School of Medicine are all together. And then they head into their research lab that summer. And they're not just doing research that summer. They actually are doing some what we call problem solving sessions, where they're working together in small groups, reviewing topics that you were exposed to in college in terms of refreshing biochemistry and genetics knowledge, which is important because we have a percentage of our graduates that have taken gap years or have taken time off since college. And we want to make sure everyone's on the same page, but also get get used to working in small groups. In addition, they're doing journal clubs and they're leading journal clubs with faculty experts during that summer. But we really want them to have the opportunity to learn different skills in their basic science lab. Some students might come in and have lots of experience, but we really encourage them to challenge themselves and sign up to work in a lab that maybe is in a field or area different from what they're used to.
So they get a choice. So before they get here, are they given a list of labs to start to think about, or do you guys start to plot?
So they don't necessarily get a list of the PIs, but they will get an opportunity to voice their areas of interest that they would like to work in. We very much want to make sure that their experience is a good one and that they have good mentors. So most importantly, we want to make sure we have research advisors that are going to be good mentors, but also that have had some experience over the years working with other students, and we've gotten good feedback about their time in the lab.
Cool. So the students start off in getting refreshed on things, and what are some of the, so you've been through the curriculum, obviously.
Yes.
As you look back, has it changed a lot, or is it kind of the same format?
So it is true that I was a student in the inaugural class of the college program. And believe it or not, it hasn't changed that much. It's improved for sure in terms of something we value is getting feedback from the students. So students' feedback about the different courses they have or the experiences they have, we incorporate that and make changes. Problem-based learning, which is a huge part of our curriculum during the first 2 years. Before, we used to just come into the room and we just all would go at it. So we'd have 8 people in the room. And,
in a case.
In the case. And it was very structured in terms of the patient case and the topics we were supposed to hit on. Those are very much the same. But in terms of making sure that everyone was able to participate, we didn't have as firm guidelines as we do now. And now we have roles where a student, it might be the facilitator that day, or might be the scribe that day, or the person that has the laptop open and can look up quick information.
So there's only one laptop open.
It's typically, yes, that there's only one person that should be quickly looking up information so that the other folks in the room are really engaging and communicating with each other. We want to encourage all students to have the opportunity to participate. And in general, we're looking for people that naturally do that in small groups where they encourage others to be engaged and don't try to dominate the group. But there is a little more structure now to PBL in terms of these different roles people play to allow that.
So I think, to be clear, something that's unique about CCLCM is that it's all problem-based learning. Right? The first 2 years? Are there any lectures?
So there's not lectures, but there are what we call interactive seminars. So in addition to problem-based learning, so on Monday, Wednesdays, and Fridays, all first and second years have a 2-hour problem-based learning session, which are small groups of 8. Then there are interactive seminars that are faculty developed, but they are a model where the students have some background reading that they're supposed to do beforehand. So when they come into the seminar that day, they are expected to be able to engage in conversation, ask some additional questions. There'd be maybe cases that would be presented that they discuss, but you'd have to do the background reading to be able to be part of that discussion in the classroom that day. So
the typical week for, say, first and second years they have 2 hours of PBL with their teams. And then
usually about 2 hours on Monday, Wednesday, Fridays of the interactive seminars.
And then Tuesday, Thursdays?
So Tuesdays they would have, so it varies from week to week, but they might have more of what we call clinical correlations, which allows the students to see what they're learning about in real time. So they might walk over to the Cleveland Clinic, into the hospital, and have a quick overview of a topic, and then they go into an EKG lab and get to see it in real time. In addition, we have what's called Art and Practice of Medicine, which is a medical humanities portion of our course, which requires some reading on a variety of topics, and then they come in and reflect on that as a group. They might do some reflective writings about something they saw in the clinic that made them uneasy, or reflected on what it means to be a first-year medical student and some of the challenges that they've needed to overcome during their time at the school, or just getting to this point.
Yeah. Well, one thing that's I think important to point out is that the CCLCM, the classes itself are small. There's only 32 students that enter each year. When they're in their small group teams, are they about 8 students per small group, right?
8 students, but they rotate.
Okay. How often do they rotate?
So in PBL, it's going to depend on the organ system.
Okay.
It's depending on how long it is. So they might be together for 8 weeks. They might be together. So it's enough time to learn about how to work with different individuals. But we do think it's important to switch it, because different people have different communication styles, personality styles, learning styles, and that gives them the opportunity to experience that. And we have, in addition to PBL small groups, other small groups. So we have a communication skills part of our curriculum where there's small groups of 4, and they work with a faculty facilitator, and that's where they work with standardized patients, learning how to interview a patient. The first session might be just walking into the room and how do you introduce yourself to the patient to make them feel comfortable? How do you sit down and shake their hands? How do you sit in the chair?
It sounds simple, but I find students are more nervous about some of that stuff sometimes, about just coming into the room. I hear that all the time.
Yeah. And it's important to have that opportunity to practice in what we'd consider a very safe space for them, because we do have our students as early as September going into the clinical setting. They will spend time with a longitudinal preceptor that they're assigned their first year over the next 2 years, where in year 1, you go for a half day every other week and work in a family medicine or internal medicine clinic. And then your second year, you go every week for a half day and work with that same preceptor over time. So they get to know you, they get to know your skills, but you are working and talking to real patients. So having that opportunity to work with the standardized patients and then translate those skills into a real clinic is valuable.
Do the students get to choose the types of preceptors that they want to be with for that longitudinal period? Like they say, I'd like to be with a cardiologist, or I'd like to be with a family practice physician. So
during the first 2 years, they only are working with internal medicine or family medicine, just to build that foundation. But during their 4th year, which is their research year, where they're doing their master's level thesis project, they are required to do a half-day clinic every week, and they can choose to work with a cardiologist during that year if they like.
So we talked about how the small group teams work. And do all the teams get the same cases every week? Those 4 teams, are they all the same?
Yes. Okay. So the students are given this, regardless of what group you're in, you all get the same case. We are very careful to make sure that all the groups are addressing the same learning objectives. Each group might have additional learning objectives that they decide to cover, but the students really are in charge of driving the curriculum. So at the end of the problem-based session, they're going to come up with a list of learning objectives they want to learn. They're going to prioritize them and then assign them to each other to come back and present. But a faculty facilitator is in the room to make sure that they're touching on the high points. If they're not, then at some point they might give them a gentle little nudge or clue.
Go look at this.
You might want to consider this for the next session. In addition to us making sure that everyone's hitting on the same learning objectives, the students also have a file where they keep presentations that they've given to each other, and students from the same class can look at the other group's presentations. So if they are a little anxious or concerned, are we in our group touching on the right things? Are we learning the right things? They can look at their classmates' file and usually see that, yes, we're all covering the same topics.
Do the preceptors have like a teacher's manual for the case, so they kind of know what the official learning objectives are supposed to be?
Yes.
To help kind of guide
we
them?
have a very in-depth faculty facilitator guide to ensure that the students are touching on the same topics and they're covering the high points.
Do the students have to diagnose in every case? do you have to come up with differential diagnosis, or are some cases, I know like in the university program, some cases present something like it's a 50-year-old male who has a history of diabetes and shows up in the ER, blah, blah, blah. So you kind of know already what's going, that you're not there to diagnose them with the diabetes.
Right. Every case can be different. So there's similar situations where based on what organ system block you're in, and they might present a diagnosis. But during the first year, the students are encouraged to look at the case and think about, if a patient walked in with this diagnosis, what do I have to know from the very basic physiology, basic anatomy to truly understand what's going on? Second year, they're going to be adding more pathophysiology to that. They can still do that in their first year, but second year, they're going to loop back around to some of the same organ systems they've already covered and have a strong foundation from first year of basic physiology. So now they're adding more of the pathophysiology onto that. They can add more of the differential diagnosis because they have a better foundation of knowledge. And they can touch on different therapeutics, mechanisms of actions, why they work in this setting.
Wow. Because I think some incoming students are a little apprehensive, or it's kind of daunting. Like, do we expect the agent to come in and start diagnosing in these small group cases?
No, not at all.
Yeah, there's a process to get people kind of teed up and kind of gradually build that skill set to get them where they need to be.
Yeah, but having that environment where the information isn't spoon-fed to you, you have to seek out the information. You become comfortable being in situations where you don't know the answers right away. And that's reflective of real life as a physician or as an investigator. A patient's going to come in, is not going to be carrying a textbook and say, just so you know, I have this diagnosis. And now you just look up that diagnosis and tell me what to do. There is detective work, and it prepares you to see the most complex patients and calmly determine what's the most important information for me to find out to help this patient.
What is your, again, since you've been through this and working in those small groups, what were, as you look back, some of the benefits of working in those small group teams with, just 32 of your closest classmates? I mean, when you think about that and now see students doing it now, what are some of those benefits?
You get used to acknowledging that you don't know everything and that you can ask others for help. I think coming into the curriculum, and I prepare students even when they come to interview here, realize that most students don't have any problem-based learning background. They're not familiar with this learning environment. And when you come into your first group, everyone's going to be acting a little strange probably the first week, either thinking, oh my goodness, everyone around me is smarter than me and I don't know any of this. But that's not true at all. Everyone's feeling the same way. Some people might be talking more than usual. Some people might be talking less than usual. But you figure out after that first week sort of how the curriculum works and what you're supposed to do in the small group. And then everyone settles into their normal behavior. But working in the small group, it's a very safe space to ask questions, to, we call them TAFEs, or targeted areas for improvement, to be very open and honest about your TAFEs, and then come up with a learning plan on how to address that and how to gain that knowledge.
When do the TAFEs come up? In group or with your preceptor?
So both. It's all part. So we have no grades, no class rank.
Let's talk about. We'll get to that.
But so part of the foundation of our assessment system is competency-based assessment, and part of that is identifying strengths in TAFEs, or targeted areas for improvement, in a variety of areas. So one might be within medical knowledge. You would highlight in your own personal reflective assessment, but also your peers who are in your PBL group, your faculty facilitator in the group will also give you verbal and written feedback about your strengths and TAFEs in those areas. The written feedback comes at certain time points, mid-block and end of block for each PBL case or session, but that is when the TAFEs come up. So it's from the very beginning of the curriculum.
So it requires a lot of self-reflection too.
And it's not easy to receive or give TAFEs. And it's getting used to recognizing that everyone has areas they need to work on. And if you don't, that's not the truth. I mean, everyone has, I have things I am constantly working on. I'm constantly reading about each of my patients that I see. And so it's getting very used to seeking out feedback and reflecting on the day and what you could do better.
Now, you wear two hats, the admissions hat and the student affairs hat as well.
Right.
So when have you had new students come to you and say, like, this is the first time where they've been evaluated this way? And have you received kind of like students coming to you going like, what do I do with this? And how do because it's not a grade, it's not an A, giving you that pat on the back, that external validation. Well, you've mastered this, you got an A, so we can move you along. They
don't necessarily come to me as often with that. They likely are perhaps talking to their physician advisors about that. So each of our students is assigned a physician advisor or pretty much a coach while they're here that sticks with them for the next 5 years. And this physician advisor is the only other person who can see their written feedback in terms of their strengths and their TAFEs. Yeah. So they meet with them about them. And it's quite possible that they talk about some of those concerns. We do know that in general, and having been a student myself, yes, there is a little uneasiness in the beginning about someone pointing out a TAFE that you have. And at first it hurts a little bit because these are all very accomplished and motivated students and everyone wants to do well. But looking at that as a opportunity to grow and a constructive source of input.
What would be, you mentioned a couple of what these TAFEs would look like. What would be like some of the personal ones that are kind of common that you hear new first years kind of get like, most first years, one of their TAFEs is usually this. If it's not medical knowledge, because everybody's probably going to be some kind of medical knowledge along the way. What would be a common one?
So there can be a transition to coming to our program and recognizing the level of responsibility and professionalism that comes with it. You are expected to show up to every PBL session and to show up on time. You have to come to the interactive seminars because if you're working in small group and half the group doesn't come, it just doesn't work. And initially, we expect in everyone's feedback for there to be a TAFE so professionalism is a competency, and it might say notice that you're arriving to PBL 5 minutes late, or you were supposed to be the scribe today, but you weren't sitting and ready with your laptop open when the rest of the group was ready to start. So those are some more common ones in the beginning. Then those tend to reduce because people get used to the environment. And it can be presentation style. So you tend to try to cram too much content into your presentation. And if you did this, this, and this, it would be beneficial to us as learners. We do encourage faculty and students to be as very specific in their feedback as possible. So it's actionable feedback.
Not just like vague, like comments. Like you need to be more succinct.
Yeah.
But why or what?
Exactly. This presentation you were doing on this, you did this and you could have narrowed it down to this. Same thing with strengths. Good job. Well, what did you do a good job on? So we want the feedback to give a specific example for the student really knows I should continue to do this.
Oh, that's good. I think it's important for people to hear that too, that it's not just about finding things that are weaknesses or areas of improvement, but like there is also like, you're really good at presenting this, or you're really good at something else.
And usually there's a lot more things listed in the strengths column than the TAFE column.
Hey, we talked about, you mentioned a minute ago about the grading system. Again, another unique feature, there are no grades. So help people understand how does that work? And then the other common question is like, well, what does the residency programs think about that if we don't have grades?
Yeah, so the grading system or lack of grading system, it is based on these assessments. And the students get, during their time here as students, they get close to 600 pieces of feedback from faculty and peers to review and reflect on. The assessment or the competencies, we have 9 competencies, and they very much parallel the type of competencies that residents are assessed on. So it's research, medical knowledge, clinical skills, clinical reasoning, professionalism, communication, reflective practice, healthcare system. So there's a wide array of competencies that they're assessed on. And it's an adult learning model. So in the future, when you're a practicing physician or a researcher, no one is going to necessarily sit you down and tell you you're deficient in this area or this area. You really have to determine that yourself. And I try to instill or talk to students about, feel that at this point in your career, you've already proven that you have the ability, intellectual ability and academic ability to be successful here. But now it's really your turn to be more of an independent learner and work with your colleagues to accomplish an educational goal. The curriculum is, or the competencies that the students are expected to reach certain milestones at the end of each year. There is a process, a portfolio process, where students will write about each of these competencies, and they pull and cite evidence from the feedback they've received. So similar to if you're writing a journal article and you're citing other articles as a point of reference, we have a whole portfolio system that does the same thing. All their feedback is given a number, and then as they go through the year, they tag it with, this would be a good thing to highlight in my medical knowledge portion of my portfolio. And they write up a document, and then that document is given to the MSPRC, which is the Medical Student Promotions and Review Committee. It's a large group of faculty that very carefully go through each portfolio. They click on the links, look at the evidence, and make sure that the student has reached a certain milestone. If they have not, so they might reach that competency or met the expectations. If it's met with concerns, they'll be asked to develop a learning plan with their physician advisor, and then the MSPRC will check in with them in a few months. And are there students that are not successful in multiple competencies? Yes, sometimes it happens. It's not very often. But in that case, there might be a more intensive remediation for that student, or there has been a few students who have needed to repeat a year. So it is a very rigorous process, despite the fact that you don't have a letter grade. It's a different type of assessment system that still has, we still have high expectations for our students.
So a lot of self-reflective writing goes into this.
Right. But citing appropriate evidence, and a physician advisor will hold the student accountable that they're being balanced in the evidence that they provide. So you can't just present only your strengths to the MSPRC. You've got to do a balanced reflection. These
are areas that I'm still working on. Which I think is, everybody's working on something.
Exactly.
We're all working on something.
Right. We're not expecting perfectionism.
Then because then I think usually, like I mentioned, the kind of the follow-up question that I hear sometimes is, then when I'm applying to residency, if I don't have grades, it's not pass fail, I don't have honors or high pass or whatever, what do then residency programs see when they're applying to their residencies?
So when they apply to residencies, their application obviously is going to look different. So the transcript is not going to show honors or commendable. Their transcript will say that they met or exceeded expectations, or if they met with concerns, it would say that. What stands out on the application is the letters of recommendation tend to be from people that got to know them really well, because they were able to engage perhaps in the learning environment a little bit differently than some other medical students, because they were participating in the clinical rotation just because they wanted to try to get that honors, but they were really there to learn and help out the residents and the staff and the support staff that was on the floor with them. The application also will have a strong letter of recommendation from their thesis research advisor. So every student does do a full 12 months of research, and that's someone who gets to know them very well. There is often, almost all of our students do have scholarship that comes out of that year, and even manuscripts that come out from research that they've been doing even before they get to their research year. So that shows, shows their dedication for innovation and passion for research as well.
Let's talk about that research piece. So, because that's the unique feature. It's a 5-year program, because at one point they'll dedicate 12 months to this master's level thesis. And you said earlier that research starts the day after the first day of orientation. So students are being exposed to different types of research in the first 2 years, basic and clinical science?
Right. So the second summer, or the summer after their first year, they are doing a clinical research project. Okay. And so that is, you did basic science first year, clinical research second summer, and then the second summer has a very strong epidemiology and biostatistics course as well. So it prepares them for the clinical research they may do.
So then when do they choose what the research thesis is going to be? At what point do they have to present here's a proposal I plan to do. I've been doing all this research in the last 2 years, and now I want to do this question.
We have a research education committee that needs to approve all of their projects to make sure that they're hypothesis driven, that they're of high enough value to take a full year to accomplish, but at the same time that it's doable. If they come forward with a large clinical trial, multi-centered, we know that takes years and years to do. So we want them to feel like they can accomplish something during that time. It does take planning during their third year. Okay. So they're going to be on their clinical clerkships, but they do, by January of their third year, they should have a good idea of what they're going to do, because they have to reach out to the principal investigator who is agreeing to work with them. The students, we really want them to largely be involved in developing the project they're going to be working on. So if they're doing clinical research, they're going to have to write and develop their IRB proposal. They're going to have to submit it to the IRB committee and get it approved before they go into their research. If they want to go elsewhere, if they want to go outside of the Cleveland and go to the NIH, they have to get their application in also around that time. So there is some pre-planning that goes into it.
So just to recap, there's first year, they're doing basic science research. First summer, in between first and second year, clinical research.
Correct.
Second year, more clinical research. And then after the second year, then the biostats epi piece.
The biostats epi happens during their summer when they're doing a clinical research project. So that's after the first year. During that summer.
And then they start third year clinical rotations.
Right.
And they're thinking, what am I going to be doing?
Exactly.
Okay.
We do in the past, and this is another change that has happened over the years. In the past, there was more flexibility on when the students would be doing their research experience. One benefit, I think, of having the research year positioned in the fourth year is that often students like to have their research aligned to the area that they might want to go into in the future, apply to residency. It doesn't always happen, which is completely fine. But until you actually get into some of the clinical rotations, it can often be hard to imagine what you want to go into.
Did you change your mind?
Oh, definitely.
Yeah.
So I do medical dermatology, or I see patients with complex dermatology conditions, but that was not even on my radar coming into medical school. No, not at all. It wasn't even something I had thought of. I had never been exposed to a dermatologist, especially an academic dermatologist. So I thought I was going to be an infectious disease doctor, rheumatologist. I knew more of a medicine specialty, but it took me by surprise. And for me, it was not as much my clinical rotations, but I started my research year with a dermatologist who was doing research on wound healing and looking at various ways of treating skin cancers that didn't involve surgery. And during my time doing research, I went to all the resident lectures. I saw how they learned about dermatopathology and the surgical aspects. And that's what convinced me to go into it, because that was my first exposure as a subspecialty. It's hard to really get the opportunity to be exposed to it as a level where you can envision yourself doing it.
Oh, that's cool. So then when students take that year, what if their research requires, another common question I hear is, what if their research requires funding? If they do, how does that work? Then do they have to write grants? Do they go through that process?
So yes, some do, depending on what type of research they're doing. Many of our students do apply for additional funding or scholarships that can even allow them to continue doing their research in the Cleveland area. Some, as I mentioned, do funding through a Sarnoff Fellowship or the NIH. Yeah. Other students, they're funded through their PI's grant. So they know through talking with their thesis advisor early on that is part of their NIH grant or whatever grant funding or research funding they have, that they'll be able to support a student, and that's what would support them that year.
How about international? Can students do because this is get this all the time. Can I do research internationally?
Not at this point. We did in the past have more flexibility in that area, but again, we really want to ensure that each of our students is having the top level of experience, research experience that they can have. And it's a little harder to gauge the experience they're going to have if they're in international lab versus some of the programs that we've established relationships with here in the U.S.
I think students, we've talked about this before and I've talked about this with other admissions people, that it's a common, students want to go do things internationally, but there's a lot of logistics that are involved. And we've talked about funding before, that research dollars are very precious. And I understand that's like, if you're in, I don't know, Tanzania and you have this big grant, why do you want to bring a med student over and train them on your dime and then send them back when they probably have a bunch of grad students there in Tanzania that can do the work? So there's... Yeah.
And there's other ways, and you know this as well, just within the K School of Medicine, there's many other ways that students can, if they want to be involved in global health or travel internationally, that they can do that. Not for the length of time, perhaps, as they could for a full year, but we do encourage that. But for the research year in particular, we would like them to stay within the U.S.
And I have to think during that research year, there's certain points they have to, it's not just, hey, see you in 12 months.
No. There's a committee.
Milestones. Okay.
Yeah, so this is a master's level thesis project. They have a thesis committee that they have to meet with at least every 3 months. And there's an evaluation form that's filled out because we want to make sure that the student is progressing. And then by the end, they do produce a thesis document. They do a defense, and they do have to do this by a certain time in order to fulfill the graduation requirement. There are a proportion of our students, and it varies from year to year depending on interest, who do dual degrees. And so, for example, they might be getting a master's in addition to their MD in clinical research, a clinical research scholars program. And for them, their thesis project will be in clinical research. So they're already fulfilling that by what our curriculum is at baseline, but then there's some additional coursework that they've done earlier in their time here at the medical school.
So their thesis for CCLCM will satisfy.
Yes.
So they're satisfying both, like kind of killing two birds with one stone.
Exactly. Yeah. Now, if a student decides to do a thesis in bioethics or another area, it might not completely align with what they decide to do for their thesis project. So they might have to do more than one project. But there's no pressure to do a dual degree. I tell students that you really should only pursue that if it's something that you think is important for your education. And if it becomes overwhelming, I mean, being a medical student is top priority. Yeah. So do not feel hesitant at all to withdraw from the program.
What about when it comes to research, and what if after 12 months, they don't have the best data in the world? It doesn't seem like it's publishable, or it just doesn't, it didn't go because that's how research goes.
Exactly.
For years, people will just fail. What if after those 12 months, it just didn't go the way they'd hoped?
Anyone who's been involved in research knows that there are things that are not predictable. There can be delays in recruiting patients sometimes, or there can be something maybe that's going wrong in your protocol and you have to tweak a technique. The difference between trying to obtain a PhD and trying to fulfill our thesis requirement is, no, you don't have to publish a paper in order to fulfill the thesis requirement. Whereas for PhD candidates, they do have to reach certain milestones in that regard in order to get their PhD. So are there a few students where they get to the end of their thesis year and they starting to get some data, but they don't necessarily have a collection of data that's at the point where it's at the analysis and publication status? Yes, we do have students that
just
are in
for
that
whatever
position.
reason, it just didn't.
Right. But again, we really just want the students to be as highly engaged and feel a lot of ownership over the project they're involved in. And it's all part of the the process.
Yeah. But I have to think though that a lot of times they're presenting posters and going to national conferences and doing that kind of stuff too.
Yes, they definitely are, and we support the students to do that. So we do have some modest travel stipends for students to go and present their works, whether it's an oral presentation or poster presentation at conferences, and many do that. So there are many other ways to share the work that you've accomplished other than a publication.
What about be like a common misconception about CCLCM, or maybe something that's about the school that you can't find on the website? There's something that you like people to know about CCLCM that may be misperceived or just not found on a website.
Sure. I think that when people think about researchers, they often think of a stereotype of someone that lacks interpersonal skills. And we don't think that's true. I mean, maybe we're looking for the unicorn here, but our program, we truly are looking for people that are fun to be around, that we can envision sitting in a small group, or the students can be sitting in a small group with, that we would want to take care of us as patients or take care of one of our family members. So we're looking for students that have not just been successful in research. So when you're applying to our program, even if you've done 4 years of research, it doesn't mean you're a shoo-in for an interview. We're looking for many different things on your application that show that you like to work with people, that you work on teams, both as a leader and as a member, that you have activities that show sacrifice for others. So you are not just a brilliant loner, that actually you like to be surrounded by other people and work with other people.
I sit in on the committee meetings and the medical students that are on that meeting. I feel like they, in particular, point out the personal attributes of positively and maybe potentially that maybe negatively affect their experience as a medical student in CCLCM, because they're the ones that are doing it every day, and I think they kind of get to see like, this works really well, and this might not be conducive to their success in our curriculum here.
Yeah, and I think CASE overall likes to attract students that are passionate, that are driven, but yet are not openly competitive, they really do want others to succeed as well. And those are the types of students we're looking for.
I think something else that's important for people to hear is that now we share the same building. And we're under the same roof. And so all of our students, whether they're university program or CCLCM or MSTP, are all here. And they're all in shared spaces. And I see them sitting out there. You do too at lunchtime. Like, they're all out in the courtyard and sitting and eating together. And they're very all socially adept. But it's a fun environment. I think they're socially intermingle, if they're not, since their curricula are separate, but they're all intermingle.
Right. And that's a question that we get a lot in terms of how often do the students interact, or do they take any classes together? And the first 2 years, no, they don't. Although we have an interprofessional education curriculum that is being built and will be launched, and they'll be together much more in that regard. But it's really not until the clinical rotations, where in an academic setting, that they're all together. Yeah. But socially, yes, they share their interest groups together. They hang out together. They eat lunch together. So they still have that ability to expand outside of their class of 32. And sometimes that can be a factor that makes people hesitant to join our program, but that's a personal decision. Some people are looking for a smaller atmosphere, and some people are not. Some people like the idea of being part of a larger group, and that's completely fine. And we want students to just come to our program if they feel like it's the right place for them. We want them to thrive here. If it's not the right place for them, that's completely okay.
Yeah. Something else that's unique is the tuition aspect.
Yes.
People always want to know, can you just explain how that works? Because it's tuition free, it's
so we don't
supported.
Right.
Yeah.
So we don't call it tuition free because someone is paying the tuition. It's just not the students. So it's what we call a full tuition scholarship. It also covers certain fees associated with attending school. So for the 5 years that the students are here, they do not have to be concerned about paying that tuition. They are responsible for cost of living and for their transportation. But the reason we don't call it free tuition is that the reason we're able to provide those scholarships is because of donations to the Cleveland Clinic or to the university, or the Cleveland Clinic itself is contributing to paying their tuition to the university. So for that reason, we like to just instill in our students how much of a gift this is and how to, it's, unless you've been through it and you're on the other side paying back tuition and loans, I don't think you can really comprehend how much of a gift it is. The full tuition scholarship didn't come into effect till 2008. So I actually did pay tuition.
I didn't know that.
Yes. We did when they announced it in 2008. So they did retroactively pay back 50% of the tuition. But I just remind the students of that there are students who actually came here not just because it was a full tuition scholarship. And that's what we want is, again, the students should not be applying to our program just only because of the full tuition scholarship, because as part of the program, you're going to be very interactive. You're going to be doing a lot of research and other things that if you're not all in, you're not going to enjoy your time.
And I think too, I mean, again, sitting in your meetings, their committee meetings, you guys are good at flushing out those that kind of seem that they're interested in the ethos of the program or might have interests more in line with like, well, it's tuition, it's covered. So
and we want the applicants to research our program, look at the website. Feel free to reach out to some of our students or admissions office to get some more information. We luckily we are finding that there are other programs across the country that now are able to offer full tuition scholarship, and we want any student who has a dream of being a physician or investigator to be able to pursue that. And sometimes that dream is not fulfilled because of financial issues. So it's nice to offer students that. And then the other aspect of being a physician investigator is we know that going into academic medicine or being a scientist or research is not necessarily the most lucrative aspects of medicine. Money should never be a reason that people are going into medicine. But if you have large loans hanging over you, sometimes we do find that students or residents in the future are making career decisions based on that. So this allows students also the opportunity to not have to have that factor into their decisions of where they want to be in the future.
So just to kind of wrap up the curricular aspects of what we're talking about here, the CCLCM has been in place since 2004. You're starting to see some outcomes, I think, from early graduates.
Yes.
What are some of those? Has the ethos of the program started to pay off? Like putting these students and trajectories of academic careers. Are you seeing that?
Yes. So when I came into the program very early on, they had us sign a informed consent to be enrolled in an IRB study. So I'm a subject of an IRB study surrounding
I didn't know that.
The Cleveland Clinical Learning Culture Medicine. I have a T-shirt to prove it. My class made up a T-shirt that said we're subject, subject this. And now, so the part of the study was going to be at 10 years out from graduation that they were going to send a survey and see where you are and what you're engaged in. Mm-hmm. We just had that first survey. So it's a small number. I mean, we're a small class. And I actually did have a few students from my class who went on to do PhDs or did an MD, PhD. Kidding. So there was 29 of us who graduated that first year. 20 people responded. And it does show that 70% of individuals do have dedicated research time, but 25% have NIH funding, 70% do have academic appointments. Almost all have research publications or are published in the medical literature. So we are fulfilling our mission.
Cool.
Definitely.
Yeah, that's great. Okay, so let's switch to the screening aspect. Okay, so we talked about all the great things and unique aspects of CCLCM. Now, when it comes to the applicant phase, so what are you looking for? I mean, so what are some of the things that you're screening for that you value in potential students that you're...
So believe it or not, we do very carefully look at each application, and it takes us a long time to do this, but we have at least 2 sets of eyes, if not more, that are looking through each application. We do a holistic review. So although we are looking for evidence that the students have been academically successful in the past, we do try to balance that with other experiences they've had, whether it's through, research or kind of background, just so that all students have the opportunity to learn and grow in a diverse setting. But one thing that I think is different with our screening process as compared to other medical schools is this research component. So we are looking for more research activity than a traditional MD program. As of now, our applicants, we are looking for at least 2 summers of full-time research.
Yeah, I think that, let's talk about that. How much research? Because that's a common question we get about CCLCM is how much do I have to feel like I'm in a competitive range to be applying? So at least 2 summer, it can be separate projects?
It can, but it really depends on what type of role you had on that project. So if you spent a summer doing a literature review, that's a little bit different than spending a summer where you were involved in a lab group and doing some of the research, contributing to some of the lab meetings. Many of our applicants do have more than the 640 hours, but it doesn't necessarily mean that the more research, as I said before, doesn't mean that the more research you have, the better chance you have at getting an interview. It can be difficult, I know, and we know that it can be difficult right now for college students or students to be able to find good mentors or find advisors or mentors that are willing to take them on in the lab. But balancing with that, just the student really showing the interest and the effort of going on and having a role in whether it's a lab or a clinical research project, continuing with it if possible. Of course, not every experience is the greatest experience, but and then you should move on. But if you found a project that you're excited about and passionate about, then stick with it. And that we are looking for students that have made a substantial contribution to at least one project.
When you say substantial contribution, that doesn't mean publication, name on a paper, because I think some people hear that and they might jump to that conclusion.
It does not. So I would say the majority of our applicants actually do not have publications.
Can you say that again?
Yeah. The majority of our applicants do not have publications.
Great. Because I think that's important because people think that they have to have that.
Yeah, no, you do not have to have that. Of course, if you do have that, you share it on your application,
Sure.
which people do, or if you've had the opportunity to even do an oral research presentation at your school, share that with us. But no, you do not have to have a publication to apply to the school.
You mentioned something about 640 hours. What was...
So that's the equivalent. So if you're due to, say you did 8 weeks of research over one summer, 40 hours a week, it's about 320.
Okay. Would you recommend, what would be your advice to an applicant that's maybe has some research under their belt? Should they continue? You said, find another project, continue on. What about gap year? Are you an advocate of, if you really want to be a competitive applicant to a research focused program, whether it's CCLCM or another type of program, to do a gap year research?
It depends on what your experience has been prior to that point. So I can think of maybe a situation where there's a student who's a college athlete. Maybe they're a college athlete on a scholarship. They really have they have to dedicate, when we know, a certain period of time to that activity, which isn't going to allow them to be as involved in research as perhaps they'd want to be. But maybe that is truly a passion of theirs. So we do find certain students that you might see that they've had a little research during college, but then the majority of their research is in gap years because they just didn't have the opportunity to do that previously. We have many students who come into our program having a gap year. Gap years can be beneficial in many ways, not just to gain more experiences, but just to get used to being in a working environment. Our curriculum is very professional. We do actually have a dress code as well. So we follow the Cleveland Clinic dress code where students have to come business casual. And because of the level of responsibility and being in attendance at all of our curriculum events, I think sometimes it can be an easier transition if you're coming from a gap year into our program, having been in the working environment.
What about, so then we're back to screening. So there's the secondary, so the secondary is a couple required essays that for all applicants to Case Western. But then for CCLCM, there's like 4 brief ones. And it's kind of along the taffy lines kind of things, I feel like. Yeah,
just telling us about, it's questions about working as a team, questions about teaching, greatest challenges, areas for improvement.
And career in the future.
Yeah.
What do you think your future career looks like?
And I just wanted to mention about the research component is, do research and do the research during the gap year if it's something you truly want to do. So definitely don't torture yourself. If research is not your passion, don't do it as a checklist item. Engage in it how it fulfills you.
Yeah. So we get through the screening process. So you're looking closely at research, obviously, and then all the other characteristics that we value in our students here. Like you kind of mentioned, like there's good communicators and they seem to be collaborative and work well in teams. And those, so you get through that process. And then it comes to the interview day. Walk us through the interview day process here.
So students get to meet with me first.
Yeah.
And I do try to be present at all the interview days. So they spend about an hour with me and we just review in detail sort of some of the same types of topics we're reviewing here on the podcast. They have the opportunity to ask me questions and then they hear about our financial package. So they hear more information about our full tuition scholarship. They get a tour of this nice building that we're in now, which people have called a large Apple store or a spaceship. So whichever one appeals to you more. And then we walk them across the street to the Cleveland Clinic and they get a quick tour around the hospital. They come back. We have a small group activity. So we actually have an activity where students are just given a hypothetical scenario that would be something very similar to what they might experience if they were a student here, and they discuss it with each other. They do get lunch. We do give them a break. They do have breaks along the way. But they, over lunch, they meet with our students and get to ask them questions. I'm not present at that conversation. Faculty are not present. And so they can really ask students whatever questions they would like to. After lunch, they do a 30-minute student interview and 2 45-minute faculty interviews. We try to, if possible, have the student interview with one MD and one PhD. That doesn't always happen because of scheduling issues, but if possible, we do try to do that. And then after the interview, we have a small wrap-up session, and then they're released.
They're done. Yeah.
So it's a long day.
Yeah, I was going to say it's a long day. I've seen them leaving here. People are tired.
And I acknowledge that in the beginning. We know it's a long day. We've gotten feedback about that. We've also gotten feedback that because we do our interviews at the end of the day, that's a little bit hard. But the reason we do that is so that they can have as much information up front. So when they go into the interview, it's really their time to share what they want with us, that they don't feel like they have to be seeking out information about the school during their interview. And then also it just has to do with logistics of scheduling. Our providers and scientists are much more available at that time than they are in the morning hours.
Everybody's volunteering their time to do this.
Exactly.
Yeah. So it takes, I don't know sometimes that applicants appreciate how much time goes into when you're assigned an applicant to review to interview. You have to read the whole application, which can take half hour, 45 minutes, sometimes longer if there's all the letters of recommendation and stuff. And then the hour or half hour to interview somebody, then you got to go write it all up. So it's a big commitment. So we kind of have to work with people's schedules when they're available.
Right.
So to that group activity, it's an evaluative thing, right? There's a couple observers.
Not a couple. There's just one observer.
Okay, one observer.
And so our director of admissions or myself usually will be present. And it's not that we're necessarily evaluating what exactly is said. We're just watching for group dynamics. So occasionally we do have individuals that are extremely dominating in the group, or an individual that just can't get themselves to participate. Not that can predict the future, but it can a little bit in terms of how they might work in a problem-based learning session or in a small group environment.
Yeah. And then what access to the application does the medical student have? Do they see the experiences? Do they see personal statements? What do they see? So
they can see personal statements, the essays that the students wrote, and experiences, but no metrics. No academic scores. We don't give them access to letters of recommendation either, because sometimes letters of recommendation will say they scored this or this.
Yeah. So. And then the faculty members, they have full access?
They do.
Okay. And how about, is one faculty, I just can never remember, is one of the faculty interviews structured and one is unstructured? Or is that something we used to do in the old days?
They're all, I would call them semi-structured.
Okay. Yeah.
So there are certain questions that the faculty and the students, we do ask them to cover, but then there's plenty of time outside that for them to ask their own questions.
Any tips for somebody coming for the interview day here? Like if you were to meet somebody that says, I'm coming in a month, what advice do you have for me? What would you tell them?
Yeah, I would say welcome. We're excited to have you. So they're our guest here. So we really try to tell the applicants and the interviewees that we're rolling out the red carpet for you, and we want to make their experience a good one. Of course, we know there's going to be nerves coming into the interview day, but definitely if your program, or we give a little breakfast when they get here, but just make sure you're well fed and you're not going to faint when you first come in. Take some deep breaths. And you want to be prepared for the interview in terms of know what's in your application, know your research, and know it in a way that you can explain it to someone else that might not be an expert in your area. But don't be a robot. So we can tell a little bit when the applicant seems like they're reading off a sheet in their head, or they can't provide examples of things that aren't in their application. Don't be surprised if an interviewer asks you for another example of something that you mentioned in your application.
Yeah. That's a good tip. When an applicant is describing their research to you, what impresses you? When you go, oh, that's pretty good. Like you think like, oh, I don't know a lot about that research, but by the way they explained it that was pretty good. Can you tell me like what that sounds like?
So when you're looking for evidence that they truly understand their research. So I might even ask some additional extension questions, but I also try to put myself in the position of a student in PBL. And if I specifically ask the interviewee, tell me about your research as if I have no background in this, but if they still can't seem to describe it to me without using very technical terms or medical terms, then that would be for them a poor performance on that interview question.
Yeah. Tell us why that's important, though. Why is that important to be able to do that?
Because our curriculum is student driven, and they have to teach each other. And so if they're only able to repeat things in the way that they know them, but not able to alter the communication style to the learner, the person they're trying to teach, then that would be a challenge for us in the problem-based learning environment.
It all ties together.
Yeah. But also with patient interactions.
Yeah, exactly. Yeah. So then after the interview day, go to committee, decisions are made at the committee. CCLCM does non-enrolling admissions. So you do 2 days, right?
Yes. Sometime in December and sometime in February, applicants are notified or extended an offer.
Because you can't go over, and because of the tuition scholarship, we got to hit the target right on the money.
Right. So we only give 32 offers, and then we sit tight until we hear back from those folks about whether they think we're the right place for them or not. So
I think something I want people to hear is that if you're applying to CCLCM and you wind up being on the wait list, it's not a bad place to be. It just function of the process. Like you have to hit a target, 32. So, but if the wait list comes, what do you want? Do you want to hear from people if they're on the wait list?
Yeah. So being on the wait list or the alternate list does not mean a rejection. You would receive a denial letter if that was the case. And despite the fact we're a full tuition program, there are students that for a variety of reasons decide that they would like to go somewhere else, especially because we have a very unique curriculum as well. And again, like I said before, that's fine. We would rather students really choose the program that's best for them. So we do every year take students off the alternate list. If they are very passionate about our program or think that we're their first choice, they are, we welcome them for them to communicate.
You like the love letters?
Yeah, that love letters are fine. But it doesn't mean that if you send a love letter that we can guarantee you a spot again, because we don't know what the movement's going to be like on the list. But they would just do that through the application portal. And we'd get the letter, or sometimes people send it through the portal and then also copy an email to me or to our admissions office.
So I think it's good for people that you track that stuff and you're interested in seeing it, because when a spot does open up, you don't want to, we all do this stuff. We don't want to just be shotgunning out all kinds of acceptances. We kind of want to be very targeted and who we think is probably going to take the offer.
Yeah.
One other thing I wanted to ask you was, and now I completely lost my train of thought. People can apply to more than one program here.
They can.
So, and I want listeners to know that so commonly students can apply to university program and CCLCM. So it's kind of a 2-for-1 in applying to our school. And then if you get invited to both programs, then we try to schedule our interview days so they're back to back. So you do one day at CCLCM and one day at university program. And we're in the same building, I mean, literally down the hallway from each other. But then the committee decisions are separate too. So students can finally get accepted in one program or not the other, or vice versa, or accepted in both. So either way, you can wind up being a Case Western student. But I sometimes hear applicants say, like, can I only apply to one program or two? But you can apply, technically you apply to all three. But I don't usually recommend people do that. All three meaning including MSTP as well. We most commonly will see, I mean, there are some applicants who only apply to the college program, but we have some folks that apply to MSTP. In our program, we do have, the college program, university program. I think that's the most common situation. But we review them separately. So our screening team can decide to bring somebody in for an interview, whereas you do not, and vice versa. Or then when we both do, then we communicate like, okay, let's try to get this one invite out so that we can coordinate their interviews. So they're trying not to come to Cleveland twice. Right. And applicants should understand that a decision by one program doesn't necessarily predict a decision by the other program. Yep. Just to kind of, I guess, wrap things up. So is there anything left that we didn't talk about? That we talked about the curricular highlights. We really spent a lot of time on the research piece and why that's important. And I think that outcome was important that we talked about, kind of the longitudinal outcomes. We talked about the screening process. We talked about how PBL works and the admissions. Is there anything else that you wanted to make sure that we get across to people about the program? I think one benefit of having such a small program, not just from a student perspective, but with our faculty, our ability to take the feedback from the students or ideas from the students on what they would like to see in the curriculum or offered and move on that quickly, we have the enhanced ability to do that. So for example, we had some students that were interested in climate change and having a student interest group surrounding that. And then we had several faculty members or leaders in the Cleveland Clinic community who have joined with them. And we have a keynote speaker who's one of my classmates, Renee Salas, who does research surrounding climate change and the effect on healthcare, and has authored articles in the Lancet and New England Journal of Medicine. And she's going to be coming back for the Cleveland Clinic Lerner College of Medicine Research Day on March 13th. Cool. And so we are able to really change the curriculum or what we can offer to the students, I think, more quickly than some other larger programs. And we like to try to be innovative and on the cutting edge with that if we can. I think one thing we didn't talk about, but is that having Cleveland Clinic as a partner is something that's pretty unique and amazing. I mean, it's considered one of the best hospitals in the world. And it's right across the street from us. I mean, and that is an amazing resource that we have here. Right. The students have the opportunity to interact with a lot of clinicians, researchers, developmentors at the Cleveland Clinic, but also at our affiliate hospitals. But yes, we have lots of opportunity to engage in activities in the full support of the Cleveland Clinic. Yeah. Well, is there anything left? I was thinking about... So one thing I didn't mention before is another key aspect that some students decide to, or a reason why students decide to come to the Lerner College program, is because of the degree of advising and mentorship that the students receive. So I mentioned the physician advisors or the coaching that they get. But also on top of that, they have the 2 research advisors from the summer. They have a thesis research advisor from the whole year. All of our deans are very approachable. We have a student buddy
program where the students actually assign the student buddies. They do a little survey to themselves and to the incoming class and try to align them. And then our alumni we're a small school. We describe ourselves as a family culture. And for that reason, all the students have access to emails and contacts for all our graduates and can reach out to them at any time for information.
Yeah, that's awesome. Any personal recommendations to listeners, like books you like to read or like to have read? Now, not like Goodnight Moon or...
I was going to say, the listeners can't see, but I'm shaking my head.
Or like Netflix shows you watch, or do you have any just fun stuff that doesn't have to be medically related necessarily?
Yeah, I mean, so my children know that Friday night, they call it Mommy Daddy Date Night, which means we just get takeout and we watch something on Netflix. I mean, that's the extent of us going out. So yes, we've watched The Crown and Big Little Lies. And so those are the types of shows we tune into.
Yeah, those are fun. My wife just finished The Crown the other day too. So she was like, oh, it's so good. This has been fun. Thanks for doing this with me. I really appreciate it. I learned a lot too. I mean, I never think I know everything there was about CCLCM, but I didn't realize that the research year was after the third year.
Yeah.
I always thought it was more flexible. Like you could do it here, you could do it there. So that's one of the things I learned today. So thanks so much for doing this. It's been
Thanks,
awesome.
Christian.
Thank you. That's it.
Yay.